Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Is my hair loss due to alopecia areata? Break. What is alopecia areata? Break. Alopecia areata is an autoimmune disorder that causes hair to fall out, often in clumps the size and shape of a quarter. The amount of hair loss is different for everyone. Some people lose hair only in a few spots, while others lose a lot. For some, hair grows back but falls out again later. In others, it grows back for good. Break. There are different types of this condition. Alopecia areata is most common in its main form, but there are other, more rare types. Break. Alopecia areata totalis means you've lost all the hair on your head. Alopecia areata universalis is the loss of hair over your entire body. Diffuse. Alopecia areata is a sudden thinning of your hair rather than lost patches.Ophiasis. Alopecia areata causes hair loss in a band shape around the sides and back of your head. Break. Alopecia areata causes bald patches on your head or other areas of your body. While there's no cure for the condition, treatments can help manage it. Photo credit, science source. Break. Alopecia areata symptoms. Break. Alopecia areata, AA, is a chronic, autoimmune disease. While most associated with temporary and permanent hair loss, it affects the nails in up to 46% of those affected. AA nails may appear pitted with lines, having splitting and/or white spots. Break. The main and often the only symptom of alopecia is hair loss. You may notice. Break. Small bald patches on your scalp or other parts of your body. Patches may get larger and grow together into a bald spot. Hair grows back in one spot and falls out in another. You lose a lot of hair over a short time. More hair loss in cold weather. Fingernails and toenails become red, brittle, and pitted. Break. The bald patches of skin are smooth with no rash or redness. But you may feel a tingling, itching, or burning sensation on your skin right before the hair falls out. Break. Are bald spots in the beard a sign of alopecia areata? Break. Yes. Called alopecia barbae, this form of the condition starts as a round, smooth patch on your beard. You may also notice that the hair loss appears patchy. Telogen effluvium, another form of hair loss, can also be triggered by stress. Break. Alopecia areata causes and risk factors. Break. When you have an autoimmune disease, your immune system less than /speak attacks your body. With alopecia areata, it's the hair follicles that are attacked. Break. Doctors don't know why it happens, but they think people who get it have something in their genes that makes it more likely. Then, something happens to trigger the hair loss. Break. You're more likely to get alopecia areata if you have. Break. Greater than a family member who has it. Asthma, Down syndrome, pernicious anemia, seasonal allergies, thyroid disease, vitiligo. Alopecia areata diagnosis. Break. If you think you have alopecia areata, you may want to see a skin specialist called a dermatologist. They will. Break. Talk to you about your symptoms. Take a close look at the areas where you have hair loss. Pull gently on the hairs at the edges of the bald patch to see if they come out easily. Check individual hairs and follicles to see if they're abnormally shaped. Examine your nails. Break. Rarely, you may have a biopsy, in which a small piece of skin is removed from your scalp and looked at under a microscope. Break. Many conditions can cause hair loss. So, your doctor may test your skin for a fungal infection or order blood tests to check for thyroid, hormone, or immune system problems. Break. Alopecia areata treatment. Break. Alopecia areata can't be cured. But it can be treated and hair can grow back. If you have it, there are several things to try. Break. Corticosteroids. These are anti-inflammatory drugs that are prescribed for autoimmune diseases. They can be given as an injection into the scalp or other areas. They can also be given as a pill or rubbed on the skin as an ointment, cream, or foam. The downside is that it may take a long time to work. Break. Topical immunotherapy. This is used when there is a lot of hair loss or if it happens more than once. Chemicals are applied to the scalp to produce an allergic reaction. If it works, this reaction is actually what makes the hair grow back. It also causes an itchy rash and usually has to be repeated several times to maintain the new hair growth. Break minoxidil, Rogaine. This treatment, which is put on the scalp, is commonly used for pattern baldness. It usually takes about 12 weeks before you see growth, and some users find the results disappointing. Break JAK inhibitors are oral prescription medications used to treat alopecia areata. Break Leaxelvi, Doyruxolitinib Leitfullo, Ritlecitinib, Alumiant, Baricitinib. Break other treatments for alopecia areata include medications that are sometimes used for other autoimmune disorder less than /speak greater than s. These medicines have differing amounts of success in regrowing hair. Break Alopecia Areata Home Remedies. Break apart from medications, there are other things you can try if you have alopecia areata. Break wear wigs, hats, or scarves. They cover your hair loss and will protect your head from the sun. Break reduce stress. Personal troubles seem to trigger alopecia areata, but this has not been proven scientifically. Break other home remedies for alopecia areata include: break styling products. Gels, mousses, powders, and sprays can help hide hair loss and add volume. A scalp prosthesis. This is a custom-made wig that fits perfectly on your head. Shaving. Some people choose to shave their head or other areas of their body to hide hair loss. Artificial eyelashes and eyebrows. You'll apply these synthetic or human hair brows or lashes with glue. How to prevent alopecia areata. Break while you can't avoid alopecia areata, treatments can ease your symptoms. The condition may keep coming back for the rest of your life. Break alopecia areata outlook. Break alopecia areata isn't usually a serious medical condition, but it can cause a lot of anxiety and sadness. Support groups are out there to help you deal with the psychological effects of the condition. Break if you lose all your hair, it could grow back. If it doesn't, there are different ways to cover your hair loss and protect your scalp. Break if you notice sudden hair loss, always check with the doctor. There can be other reasons for it besides alopecia areata. Break takeaways. Break alopecia areata is an autoimmune disease that triggers hair loss ranging from small patches to complete baldness of the scalp or entire body. The condition can also affect your nails, causing brittleness and pitting. Doctors don't know the exact cause, but genetic factors and certain triggers, such as stress or other autoimmune disorders, may play a role. Diagnosis involves an exam by a dermatologist. While there's no cure for alopecia areata, treatments such as corticosteroids, topical immunotherapy, and minoxidil can help you manage symptoms and possibly regrow hair. Break alopecia areata FAQs. Break what age does alopecia start? Break alopecia areata can affect anyone, but you'll usually get the condition from your teenage years through your 30s. Kids younger than 10 who get the condition usually have a more serious form. Break how do you treat alopecia naturally? Break vitamin D supplements and a bar less than /speak plant diet that includes fruits, vegetables, and protein could help strengthen hair and lessen hair loss. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.